26. ve 27. mezuniyet törenlerimizin konuşmacısı, Harvard Üniversitesi Profesörü Paul Farmer'ın çevrim içi olarak aramızda bulunmasından memnuniyet duyuyor. Kendisine, üniversitemize sanal bir ortamda da olsa hoş geldiniz diyorum. Ülkemiz ve tüm gezegenimizin küresel bir salgının kıskacında olağanüstü bir dönemden geçtiği, etkilerini, zorluklarını hep beraber daha hala yaşamaya devam ettiğimiz böyle bir dönemde bu konudaki uzmanlığı kanıtlanmış bir ismi misafir etmekten ayrıca mutluluk duyuyoruz. Biz kendisini seçtiğimiz zaman 2020 konuşmacısı olarak COVID'in geleceğini bilmiyorduk. Ama demek ki içimizde hissediyormuşuz ki onun gibi birisini konuşmacı olarak seçtik. Tıbbi antropolog ve tıp doktoru Profesör Farmer, hayatını dünyanın en yoksul insanları için sağlık hizmetlerinin iyileştirilmesine adamıştır. Farmer, 1987'den bu yana yoksulluk içinde yaşayan hastalara kapsamlı sağlık hizmetleri sunan, kar amacı gütmeyen, uluslararası Partners in Health'in kurucu direktörlerindendir. Profesör Farmer ve tüm dünyadaki çalışma arkadaşları, yüksek kaliteli sağlık hizmetlerinin kaynakların sınırlı olduğu ortamlarda sağlanabilmesi için yeni bir model sunan, topluluk odaklı, yenilikçi tedavi stratejilerinin geliştirilmesine öncülük etmişlerdir. Doktor Paul Farmer, Harvard Üniversitesi Küresel Sağlık ve Sosyal Tıp Bölümü Başkanlığı yanında, Boston'daki Brigham and Women's Hastanesi Uluslararası Sağlık Eşitliği Bölümü Başkanlığını da yürütmektedir. Bu üstün başarılarına istinaden Profesör Doktor Paul Farmer'a Koç Üniversitesi olarak Şeref Doktorasını tevdi etmekten onur duyuyoruz. Boston'dan erken saatlerde aramıza katılan Profesör Paul Farmer'a tekrar hoş geldiniz diyorum. I welcome Professor Paul Farmer, who has joined us in early hours in Boston. And şimdi sözü bu çok değerli bilim insanına vermekten gerçekten gurur duyuyorum. Professor Farmer, welcome and the floor is yours.
Thank you so much, Professor Randinan. And let me start by saying what an honor it is to be with you all on the day of your graduation. I also want to thank Professor Nur Yalman, my own teacher, who taught me something really important. And more on this before the end of my comments, which you'll be happy to hear, arrive in short order. I've learned already that remote commencement speeches are hard because the electricity, the spark of these new beginnings, comes in large part from the joy of being on campus and in the physical presence of students, staff, faculty, and families. I'm not sure when Mother's Day is celebrated in Turkey, but surely every graduation day should be considered Mother's Day. How many of you would be here without your mothers or someone who mothered you? Zero. And bravo to dads and grandparents and siblings and cousins to the nth degree, to all those who helped usher you through the portal of knowledge and reach this pinnacle today. I'm also disappointed to be speaking to you remotely because that means I don't get to be with you today in my all-time favorite city. The United States doesn't boast ancient cities like Istanbul, but neither does anywhere else. The Hagia Sophia, the Blue Mosque, the winding streets on both sides of the Bosporus, and your own harmonious campus overlooking the Black Sea, which I've only seen on a screen. But it's bad form for me to begin with a lament about missing out on the many charms of Istanbul. So let me turn to the usual. My remarks today are specifically directed to you, dear graduates, and I'd like to encourage you all to work towards a better world while never forgetting the world we live in right now. As is also standard in such circumstances, I note that you are leaving your splendid isolation for what many term the real world. That's what campuses like yours are intended to offer, even in the midst of an ancient and teeming metropolis. But of course, you were always part of the real world, and like all of us, obliged to find a way to succeed within it, whether on campus or off. Whether east or west of the Bosphorus or beyond Turkey's borders, you graduates are prepared, or at least better prepared than most, to exit the portal of knowledge and flourish in our beautiful, if messed up, world. What does that mean right now in 2021? Well, what is the opposite of splendid isolation? How might you flourish in a post-pandemic world, even as the pandemic of COVID-19 persists, challenging our notions of what isolation, splendid or not, might mean? Since you've invited a physician anthropologist to address you, you won't be surprised if I speak about human flourishing in terms of health and sickness. As the great hammer of COVID continues to fall unevenly across the globe, including on this neighborhood, we are reminded anew that some are spared while others are taken by the pandemic. What accounts for this great and troubling variation? Not just that due to a novel coronavirus or any other infectious pathogen, but the suffering that we might attribute to any pathogen or pathogenic force. In my own country right now, the former includes COVID-19 and the latter includes anti-Black racism and other social pathologies unique to some settings and yet generalizable to many. How else might we understand the uneven course of COVID in the United States, which has done a great job developing novel vaccines, but has performed uniquely poorly in halting the pandemic and less than adequately in caring for the afflicted? Here's where Professor Nuri Yalman's insights come in. He's a world-famous anthropologist who might argue that the best answer to these questions lies not in the variable virulence and infectivity of the pathogen, but in the variable virulence of the interlocking societies and the times in which we live. And that, dear graduates, is why public health is important for all of you, and not just those receiving diplomas in medicine, nursing, virology, or epidemiology. Turkey, no doubt, has its own social pathologies, many of them rooted in history, but it's not my place today to enumerate them. I just don't know enough. It is, however, your job to know them, regardless of which degree you're receiving today. I know as an infectious disease doctor that this is not straightforward, but there's no way to halt, much less understand, a disease like COVID-19 without some knowledge of the social world. That's why I'm also an anthropologist, and how I know Professor Yalman, who in turn taught me to better understand the social world we share with the pathogens. If we were back in the era when I first went to medical school, we would have spoken about differential variation in risk and outcome between first and third worlds. Many didn't even remember a second world hidden behind its allegedly iron curtain. I didn't then have the concepts or vocabulary to speak more forcefully about global health equity, but after a year in Haiti between college and medical school, I got the idea. After growing up in Florida, not far from Haiti, I had no idea that the United States had occupied our neighbor militarily for decades, or that Haiti was, by the time I began medical school, Florida's third largest trading partner. I did know, thanks to my school teacher father, that Haiti was born out of the global fight against slavery, but that was about it. Yet there were other reasons to understand how the United States was related to Haiti. My medical training began right at the time that AIDS was recognized as a new and ranking threat to health and well-being across the world. It struck Haiti and the United States with particular and simultaneous force, and was soon the leading infectious killer in both countries. I wrote my doctoral dissertation on the subject, incorporating what I learned from Professor Yalman. He taught me how the social world is constructed through our social connections. Early on, AIDS was quite clearly a pandemic, which was or should have been a reminder of the ways in which we're all connected. But as with COVID, so too with AIDS. We all saw a retreat into nationalism in the midst of transnational pandemics and their non-infectious equivalents. Every official report, whether from the World Health Organization or from a Ministry of Health, stressed national level reporting. But pathogenic forces like armed conflict, climate change, rising seas, mounting inequality are by definition noxious forces that are transnational by their very nature. How can we work towards a better world by retreating into nationalism or into some other form of splendid isolation? The downside of such logic is apparent in any pandemic, especially one like COVID, caused by a virus spread by sharing the very air we breathe. Because even if there are not three worlds, but one, we should all know more about what happens in places without the sorts of resources that many of us take for granted. Some term these places medical deserts, and I have worked as a physician in many of them. So here's one question for you, graduates. Isn't it possible to irrigate a desert? Of course it is. And that's what we proceeded to do in Haiti and elsewhere, to irrigate the desert with staff and stuff and space and systems. Staff like nurses and doctors, stuff like medicines and diagnostics and preventives like vaccines, space like clinics and hospitals, systems like infection control. Putting these in place also required the sort of social analysis and management skills that too few of us learned in medical school, just as too few of us benefited from the sort of social understanding that Nur Yalman shared with me. Why would such concerns and such understanding be of interest to those graduating today? Istanbul is not a medical desert, surely, and neither is Boston. We have in these cities enough of the staff and stuff and space and systems required to tend to the critically ill or injured. Just look at your own teaching hospitals. But in Boston and across New England, even our best hospitals struggled to respond effectively to COVID. And that's in part because great hospitals like the one I work in and like the ones on your campus are not the same as a public health system. Public health is the concern of all those in the public, not just nurses and physicians and epidemiologists. You graduates, have you not been deeply affected by COVID, regardless of what degrees you've pursued? Of course you have. We all have. There's no way to make a better world without broad public engagement in what it takes to keep that public healthy. We humans haven't had a proper pandemic in a century. This has allowed us to pretend that we're all naturally divided into nation states and without obligations to the less fortunate without us, regardless of nationality. But look at how we have already retreated into vaccine nationalism, which in the face of a pandemic that has made the quest for protection a national affair. Surely it's okay to applaud national leaders looking out for their citizens. But is this really the best or only way to proceed in the midst of a pandemic? It is not. And that's not why we now face a form of vaccine apartheid. You graduates need to think not only about your immediate neighborhood, but about the broader one. Not only your home, but the home we all inhabit. All epidemics remind us that we live in the social world to which you now return, which is, of course, the same world you never left. Allow me to mention as an example an affliction that has spared Turkey but which disrupted the economy of many continents, Ebola. You've not seen it in Istanbul, nor did I ever encounter it in Haiti or Boston. This is a rare viral disease that has so far been seen mostly in the most disrupted parts of rural and forested Africa, but which reminds us, as Nur Yalman reminded me, of our interconnectivity, in part because it's spread by caregiving. Nursing the sick, which in a medical desert is a task that falls primarily to family, as does caregiving's final act, burial of the dead. These were the two means by which most cases of Ebola were transmitted. I first encountered the disease, at least in person, in West Africa, which has, as the historians among you know, a special and troubling tie to the United States. In June 2014, I made my very first trip to Sierra Leone. Although Ebola was not then reported to be present in Freetown, the capital city, it was already spreading under our noses. Nurses and doctors and caregivers of all stripe were dying of something spreading there. The virus, like the novel coronavirus after it, had made an interspecies jump to humans, probably in neighboring Guinea. In a medical desert where there are too few nurses and doctors, there were other folks stuck with the task of caring for the afflicted. And these were mostly family members, as I've said, but also traditional healers. They died by the thousands. We were all scared of Ebola, especially us clinicians. Who in her right mind wouldn't have been frightened? But I was confident that we might contribute because of our experience on the other side of the continent in Rwanda. When the Ebola epidemic began, I'd been living in Rwanda on and off for the better part of a decade. And what I saw in my first trip there some 20 years ago was a medical desert. That is, Rwanda, after the genocide against the Tutsi, lacked the staff and stuff and space and systems to provide even a modicum of care for a devastated population. It was a disaster to behold, especially in rural areas. But a new Rwandan government and much of the citizenry were determined to address this disaster, and that made all the difference. They did address it with generous spending of their meager resources. Rwanda's health authorities focused on the most vulnerable, the poor, those dwelling in rural areas, women and children, genocide survivors, and even prisoners who had themselves engaged in the genocide. I know because I worked as a doctor in the country's largest prison, where 70% of inmates were there on genocide-related charges. They received medical care too. 15 or so years later, Rwanda could point to the steepest declines in mortality ever documented anywhere at any time in human history. You heard me right. And that's something I hope that every graduate will remember, because if Rwanda could pull this off, we believed, so could Sierra Leone and Liberia and Guinea, the three countries in which almost all Ebola cases were registered. And if the medical deserts of Africa could be irrigated, so too could the scattered medical deserts within my own country. It's entirely possible, in other words, to build a public health system able to prevent poor outcomes among the vulnerable. That project was neglected in the United States for decades, the results of which you've read about. We had the staff and stuff and space and systems to manufacture vaccines and develop new diagnostics and therapeutics and medicines, but not the public health system required to halt the steady march of COVID through our ranks. We've already lost 600,000 Americans to COVID. And only now is our government making the investments required to prevent such losses from occurring again. Drawing on these experiences, I want to conclude by making 3 points I believe to be germane to this discussion, and beyond that, to your lives after graduation, when the portal of knowledge must remain open. First, the mission of your alma mater is to prepare young people in this country for meaningful lives, with a focus on living them out ethically and to making your contribution to the progress we all need today as we contemplate problems that still trouble us. Again, armed conflict, say, or climate change, or health disparities. But your talents shouldn't be reserved for Turkey alone. Remember your country's place in the world, as Rwanda must too. Rwanda has, I know from personal experience, welcomed into their hospitals the sick from half a dozen countries. Many are refugees, a word heard often in Turkey. You've taken in refugees too, and giving refuge to the displaced or persecuted is a marker of decency now more than ever. Second, allow me to offer an example from another young university, one even younger than Coach. Of course, this one is in Rwanda. A few years ago, my Rwandan colleagues launched a university focused on the quest for health equity, calling it the University of Global Health Equity. Any university, including Coach and Harvard, can and must focus on equity if we want to build a better and safer and kinder world. So too for all its graduates. Third, and finally, take a moment to lift your eyes from your own plans for the immediate future and think about our shared horizons. We all need to do more to understand the world we live in. Let me share with you in closing something that my Turkish mentor taught me. Nur Yalman is a professor of anthropology at Harvard, but also a founding member of Koç University, and he is listening today. He's the person who extended an invitation for me to address you. His research was conducted largely in Sri Lanka, and his big book, one of the first ethnographic studies I read in graduate school, was so rich in detail that I worried that no medical student or doctor could achieve what he did, and apparently with ease. Professor Yalman, who became a friend, taught a course called, simply enough, Social Theory. I wish I still had my class notes, because this was the course in which I first read Frantz Fanon and Jean-Paul Sartre and several other big thinkers. It's true that most medical students don't study such figures, as we focus instead on human pathophysiology and on how to counter it in our patients. That's our job. But as Nur Yalman taught us in his beautiful lectures, we live in one world, not three. And it's a world so complex because just as we must seek to understand global or far-off events, so too must we remember that local worlds matter too. Most of all, and here's what I'd like you to remember, Nur taught us that social ills have social solutions. That is, the calamities we face aren't acts of God, but more often of our own making. And that means, dear graduates, that to flourish in a world of conflict and sickness and injury, and on a planet imperiled by human actions and inaction, you will have plenty of chance to improve it. So go out of the portal of knowledge without closing it. And thank you both for the honorary degree, which I will treasure forever, and allowing me to be with you on this day. Congratulations.